Hey everyone, it's Derek Mikulski with Orthopedic Physical Therapy Products, or OPTP, and thank you so much for joining us in this Next Level content education series. I'm really excited because today we have Kristin Smith, who is the director of the Manual Therapy Certification Program for Evidence in Motion. And EIM, of course, is our partner in this content education series. So today we're obviously going to dive into the topic of manual therapy. And Kristin, thank you so much for joining us today.
Thanks for having me. I appreciate it.
Yeah, so we're just gonna jump right in, like we have been in these interviews, with your most kind of inspirational story regarding a patient you've helped and how you've seen these, manual therapy skills improve someone's life. So can you
Yeah, I
give us
mean,
a
there's
story?
so many. It's really hard to narrow that down. But a recent story was a gentleman. He was in great shape, but he had epilepsy. So he had a seizure and he fell out of his chair and he hurt his shoulder and his upper back. And, he had continued to work out and train for this event he was training for, but he just couldn't get his arm to work right. He was having this sharp pain in his back. One session, his arm was working, his pain, he barely ever had that upper back pain again. I saw him for a few times, but within one session he was functioning so much better than he had in the previous couple months, and he was just so happy that he was able to keep training. He was able to do this event with his son, which is really why we do this, right? Because people want to do things, they want to be with their family, and I'm not sure if he would have been able to get there without that session that day. So
Yeah. Yeah, I've personally experienced the power of manual therapy and how significant of an improvement it can make in just one treatment. It's amazing. And this whole content education series is about explaining to clinicians how they can, improve their skill set and moreover take their quality of care to the next level. And this is to me such a great topic to cover in this. So let's keep going though. We're gonna get
cool.
into it next. What inspired or led you into exploring, manual therapy more so than all the other kind of silos or, that you can dive into as a physical therapist?
So I took a really roundabout route to get where I am. I originally got a bachelor's degree back in the dark ages. Somebody called it recently. Um, and, but so then I changed careers and I became a teacher for a while. So when I came back to physical therapy, I'm like, well, I better take a lot of continuing education and make sure I know what I'm doing here, which led me to Michael Moore. He's one of the founders of AOMPT. So I was at his clinic with all his people there, learning from them, and I quickly realized that I better take more. So I did his year-long class. Doesn't even exist anymore, but I did that class back 15 years ago. And once I was done there, a whole year with him, then I realized, oh, I better keep going. And so that led me to want to do advanced certifications and to evidence in motion, where, I pursued my OCS, and I went through the manual therapy fellowship with evidence in motion. And here we are 15 years later, still on that same path. So.
Awesome. Yeah. So how has, obtaining this knowledge and this skill set helped you personally take your career and, quality of patient care to the next level?
Yeah, I mean, nothing makes me happier than when a patient leaves the clinic feeling empowered to help themselves and to feel better, and I really think that incorporating manual therapy into your treatment plan is beneficial because you're showing them that you know what to do, that you know how to help them right away. And so that then helps them to walk away knowing, okay, other things she tells me, I should really keep doing these things, because, she helped me here right now, and I feel better. So I'm going to keep working towards feeling better.
Hmm. So why would you say like a clinician should consider adding manual therapy skills to their clinician toolbox, we'll call it?
Yeah. So, there's a lot of decisiveness on the internet about manual therapy over the years, and the
Hmm.
pendulum has swung one way or the other. But the reality is, when you look at the clinical practice guidelines, they make recommendations for manual therapy. And that really is the highest level of evidence where those clinicians have worked together to evaluate the whole body of research to make the recommendations on what should and should not be incorporated into your treatment plans. And the reality is they all recommend manual therapy to some degree. And so it's really important that you understand how to do manual therapy, when it should be incorporated into your treatment plan, but not doing it is really a disservice to your patients.
So, as the program director, can you explain to us what it's like to participate in the manual therapy certification program? Just a
Sure.
real quick overview.
Yeah. So I like using the word robust when it comes to our manual therapy certification. People who complete this program are excellent in both their clinical reasoning for when you should use manual therapy, as well as how to use the manual therapy, how to do things well. So most of our coursework is online with an instructor, and it's asynchronous, so you're able to work throughout the week at times that work best for you. You're not locked into specific class times, but you're interacting back and forth to really work on and understand those clinical reasoning skills. You're going to learn about the risks and benefits of manual therapy, the mechanisms, when you should use it, all of those things. And then there's 5 weekends. And so those weekends are where you're really going to work on the hands-on skills, and you're going to make sure you master those. And there's checklists for you to go home and continue to practice with your coworkers, and make sure that you really understand how to do it, when to do it, all of those things. And those weekends are offered all out throughout the country. So, there's a lot of opportunity to do this no matter where you live. I live in a rural area, so this sort of program really works well for me.
About how much time does it take one to obtain the certification?
It's about 15 months from start to finish, but
Okay.
it's designed to be for people that are working, that have families. So it's not lots of hours per week, but which is why it's spread out over that time period. But so that you can work it into being a busy person.
Perfect. Okay. Cool. Yeah, we'll obviously direct everyone who's interested in learning more about the program to check out Evidence in Motion's website. I know it's very easy to navigate, very clear to find the manual therapy program there, so that's great.
Excellent.
Okay.
Thank you.
Yeah. So last question, with all your
Okay.
experience, one thing we find, especially, the younger generation moving into, becoming a physical therapist or a PTA or even another clinician type, they always like to learn or hear our presenters provide them with a little bit of advice. So our question is, what's one key piece of advice do you give to someone entering the profession?
You have to believe your patients. You have to listen to your patients. There's always these jokes about how everybody's exaggerating their symptoms, or this, they're that, but the reality is they're trying to tell you something with that. And by creating that therapeutic alliance, you're really helping them in the best way possible. And this fits with manual therapy too, right? If you don't have that strong therapeutic alliance, then you're not going to have the best shared decision making about when manual therapy should be used, how it should be used, how much should be used. And so you just really need to get to know your patients, to trust them, and to help with that shared decision making in order to provide the best care possible.
Hmm. Perfect. That's excellent. Well, you've provided us with a ton of really great information here in a pretty short period of time. So thank you so much, Kristin. Is there any final words you'd like to leave people with before we sign off here?
Yes, I mean, I just feel very happy to have this as my career, and there's a lot of reasons people say that it's a tough career these days, but really it's quite rewarding, and it's a great thing to do, to continue with your education and be these lifelong learners, so that again, so we can best serve our patients, because that's really why we're here, to help people live better lives.
Perfect. Yep. That bleeds through, in every interview that I do for this content series, everyone's so passionate, which is wonderful because you don't get that in every profession. PTs are so passionate about what they do. And um, on that note, I guess, just a little OPTP plug here is we supply all sorts of orthopedic manual physical therapy tools. And so if you're not familiar with OPTP, definitely check out our website as well. But we definitely want to refer people to Evidence in Motion so they can learn more about the manual therapy offerings. And yeah, we appreciate everyone joining us today. Hopefully we provided you with some value in the way of education. Kristin, I want to thank you so much again for joining us, and we'll see everyone next time. Until then, thank you.